Hello everyone, my name is Samuel Mota and I'm a student here at UTBV. These past 8 weeks I've had the privilege of working with my mentor Dr. Chao Dong on the synthesis of a 1,4-diketone as a precursor to a drug used to treat gout. Gout is one of the most common types of inflammatory arthritis and it affects about 9 million people in the US. When one suffers from it, there is an overproduction of uric acid from the degradation of purines by the enzyme xanthine oxidase. Now, there are already medications that inhibit this enzyme, but many are either usually too expensive, not very effective, or can actually result in kidney damage. So we're working on a precursor to an improved drug. Here in figure 1 we can actually see a diagram showing the route for this precursor. So we have quite simply this methyl ketone plus this bromo ketone gives us our diketone. How do we actually do this? Well, we put it in a Schlenk line seen in figure 2, which allows us to protect our reaction. In our main reaction vessel we added zinc chloride, benzene, diethylamine, and tert-butyl alcohol and allowed this to stir for 2 hours. At which point we added our main reactants, our methyl ketone and our alpha bromo ketone, and allowed this to stir for 16 hours. We were then able to start our purification process, and it was made somewhat difficult due to the sludge-like nature of our product, but we did, struggle through it. Here in figure 3 we can actually see our product 2 was run through column chromatography, and you can see there's multiple colors here, indicating that we might have to improve the way we do our purification process in the future. So due to the fact that we're still on small scale synthesis, we didn't get a whole lot of product. From trial 1 we received 145 milligrams of product, and from trial 2 we received 326 milligrams, but we still did a lot with this little product. From trial 1 we had collected IR data, but we had also collected IR data of our methyl ketone over here. This allowed us to compare the two and see how they were both similar and how they were different. Here in the 3000 range we can see the CH stretching of both our methyl ketone and our product from trial 1. In the 2200 range we see that we have like a cyanide group in the same place, and we also in the 1800 range have an aromatic compound, and in the 1700 range we have a ketone. So in other words, they're very similar, which is good, but they're also different, which is just as equally good. Here in the 1700 range, once again, we see that the blue line, our product, exceeds the orange line, the methyl ketone. This is important because, well, there's more ketone. In other words, we have our diketone. But we also have new peaks in the 1500 range and the 800 range, indicating that it's something chemically different. So based on what we currently have, we can't necessarily say that what we have is exactly what we want, but it is similar to what we want. In order to continue, we need to collect more NMR data on what we have and what we get in the future. We should also perfect our purification process. To bring everything to an end, I would like to thank LSAMP as well as UTBB for helping me in my research endeavors, and I'd also like to extend my gratitude to Dr. Dong and Dr. Montes. Thank you, and I'd like to continue this project.